Yesterday's devastating shooting, mental health is a renewed focus. Here to talk about healing after trauma is psychologist Dr. Saunders. Dr. Saunders, thanks so much for being with us.
Thank you for inviting me, Erica.
Now, Dr. Saunders, this shooting is hitting home for so many individuals. So many people are hurting in the community, from the officers who responded to people who knew them, to neighbors, to friends. What can people be doing? What should people be doing to make sure that they're okay emotionally?
So in situations like this, I like to remember about what we call the disaster pyramid, right? So it starts with those that are most directly affected, then it goes to kind of friends and family, and then medical and rescue personnel, then community members at large, and in a situation like this, these are all small communities. So when you are talking about the community members at large, it really hits home for so many people. There is some point of connection for so many people, and grief reactions and trauma reactions are so varied. But I think what's important to remember is that if you are a vulnerable person, if you're someone who has experienced a significant loss, something like this can be very, very triggering for you.
Yeah, and the thing that we have to keep in mind is two people, as you mentioned, you might both have a connection to the victim or the situation that happened, but you could react in completely different ways. One person could be totally fine and another really suffering from the signs of trauma. What should we be looking out for?
So in situations like this, you know yourself. Are you someone that immediately goes into feeling tired and exhausted? Or are you someone that feels like angry and irritable, or very sad and teary, right? So it's about knowing ourselves, knowing what our typical reactions are. Some people are more emotional. Some people become more isolative and shut down. But it's really communicating with the people closest to you. Listen, I'm having a hard time. This is what's going on. And just so that we don't increase worry in people around us, because everyone's grief reaction is different.
Yeah, a lot of people want to do something to help. They want to cook. They want to bring flowers. They want to do something. But what else can we do to help our neighbors coping with trauma?
So these are times where we need to connect with members of our community and reach out to people. It's times like this where we really need to feel a sense of belonging, and so that's what's so important with such a tragic loss in a nearby community like this. So take the time to reach out to people. Allow, if someone's reaching out to you, allow that to happen. So it's really being a little more gentle with ourselves and really focusing on the care that we need in a given situation like this.
Now, another aspect of this tragedy is because it's a small community, there may be a lot of people out there who knew the shooter or knew of the shooter, and maybe they're asking themselves right now if they could have known, if they should have known, if they should have seen a red flag, and they're dealing with some guilt.
Right, and that's a really difficult emotion to manage. But in situations like this, often there's a huge impulsive component to it. And so I don't want people to really dive into that feeling of guilt, or, while I certainly want people to take responsibility for not just themselves, but the people around them, people closest to them, diving into guilt at times like this is really not a helpful emotion to manage. So if you're really struggling, talk to someone, talk to your local your primary care doctor, get a referral, find someone to talk to, a professional to talk to.
Yeah, and people should not be afraid to reach out and ask for help if they do need it.
Right. Don't be afraid to acknowledge that you're really having a strong reaction based on your connection to this and other vulnerable losses, and don't be afraid to reach out for help should you need it.
Absolutely. Dr. Saunders, so helpful to talk to you. We do appreciate your time and all your insight.
Thank you, Eric.